There's multiple ways of replacing teeth, and the typical ones are dentures. There's also bridges and implants. Implant is the best option, and dentures are the most cost efficient. There's some limitations involved with dentures, and also if you have minimal bone on the bottom or top, then what happens is your dentures aren't as stable. Implants, of course, they're going to mimic your natural tooth. So an implant replaces the root structure of the tooth. And once an implant is placed, a dentist is allowed to put a replacement over that implant, such as a crown or a bridge, or you could create a denture that actually connects to the implants, which is called the overdenture. And it's a lot more efficient, and you're going to be afraid or worry about if they're going to be falling out or not. And the aesthetic, it mimics a natural tooth, so it's going to look a lot more realistic. A lot of times you can't even tell that it is an implant. Of course, implants do cost more, but if you really think about it in the long term, you're actually paying less, because with a denture, you're going to have to replace a denture typically every 5 to 7 years. With implants, you don't have to replace them as long as you're taking care of them and you maintain your oral hygiene. Because if you don't take care of your natural tooth or the implant, the bone around it, you could lose the bone around it and your teeth become loose. Typically, we recommend every 6-month checkup. So during those 6-month checkups, we take an x-ray of the implant just to make sure there's nothing that could create periodontal disease around that tooth, and making sure that it's stable. After an implant is placed, typically there's a 4 to 6 month healing period, and once that healing period is done, an impression is taken, and from that it's either probably about 3 weeks, maybe 4 weeks, once the crown or the bridge or the denture is fabricated. When someone's interested in an implant, it does involve more time. During that time, what happens is we provide a temporary partial or provide a temporary denture until the final product is made. So that way you're not going to have missing teeth throughout that period, 6-month period of healing. The first step is, of course, to get a consultation or an examination, and from that point, we could discuss the best option, what they like, and kind of go from there.